Okay, good morning, everybody, and welcome to the Administration and Operations Committee meeting for April the 16th. Thanks, everybody, for attending here. We've got a full house, which is kind of nice. As far as the committee, note that all committee is here. As far as the agenda is concerned, anybody have anything to add to the agenda? Okay, seeing none, there is an addendum to the agenda. If I could get an approval with the addendum, Mayor Bailey, Councillor Oakley, any questions? All in favor? Opposed? That is carried. Thank you. Declaration of pecuniary interest. If you have any now, please state. If not, if something arises through the meeting, be sure to let me know. Delegations and presentations. We got a couple of them today. I need a motion, if we could here, for both delegations, 4.1 and 4.2. The procedural bylaw waived to permit the excess time of 10 minutes. Councillor Coleman, thank you. Second. Councillor Kyle, thank you. No questions on that. All in favor? Opposed? That is carried. Thank you. So our first delegation, 4.1, is Patricia McCarney, President and CEO of the, and Director, Justine Hamilton, the Director of City Certification and Data Applications for the World Council on Data. If you'd like to come to the front, if you could. And if we could just get you to state your name if you can, and go ahead whenever you're ready.
Good morning. It's such a pleasure to be here back in Brant. We took the train over to yesterday, so it was a very nice ride. We didn't have to sit in the Gardiner Expressway traffic. So it's a pleasure to be back in Brant and to say good morning to Mayor Bailey, councillors, ladies and gentlemen. On behalf of the World Council on City Data, we're so pleased to join you this morning. And we're starting to, I think most of you have gotten to know the ISO 37120 series that we're here to provide certification for the 5th year in a row for the County of Brant. That's really a stellar accomplishment, so congratulations in advance. So just as a little bit of background for some those of you who aren't as familiar, this ISO 37120 certification, the County of Brant is receiving the Platinum certification today, which is the highest level possible. So congratulations on that. This ISO 37120 is really a global first. It was the first standard ever published in Geneva by the International Organization for Standardization, where we were aiming to, in our development of it prior to 2014, we were attempting to make a really trusted source of data for cities across the world that was comparable, standardized, globally standardized, and also third-party verified. So it's really the highest caliber data that the County of Brant is now building with a 5-year data continuity over the years, which becomes really important for governance, for planning and management. And so for the first time, this ISO 37120 equips municipalities worldwide with standardized, globally comparable, independently verified data. So in other words, municipalities across the globe are equipped with apples to apples data. And you're joining a network now of over 100 cities. We are now active in 40 countries, so it's become very popular globally, this standard. And it's a real accomplishment and we're very happy to have the County of Brant as part of this global network. So the 5 certifications are there. Congratulations to County of Brant for their 5th year of data. This data continuity being so vital for planning and management across the city. This certification is a true demonstration of Brant's dedication to building high caliber data that supports sound governance and drives sustainable development and prosperity into the future for your citizens. And I would be remiss if I did not address at the outset here the incredible dedication of your staff at the County of Brant, including the expertise of Adam Crozier and Delia Reich under the leadership of Chief Administrative Officer Alison Newton, who really pioneered this work at the outset 5 years ago, recognizing the importance of high caliber data in the county. So thank you very much, Alison, for your leadership on this. I would also like to take this opportunity to welcome Haley Gilmore to the work and to thank all the excellent data custodians across the county and all the county departments who were so instrumental in this certification process. So as a result of cities asking for further measurement on both the rising agendas of smart cities and resilient cities, we took it back to ISO and created two new standards: ISO 37122, Indicators for Smart Cities, which helps cities to track year-over-year progress on the smart city agenda and to help to inform a city's decisions on the acquisition of smart city technologies and systems. There's a number of cities early adopters on this new standard across Canada and across the world. We've also, in response to that second rising agenda on resilience, to think about flooding and fires and all the risks and disaster issues that are confronting many municipalities across the world, we went back to ISO and created ISO 37123, the third standard in the series on resilient cities, to help to build profiles on risk and to better prepare for and reduce those risks over time and to recover from a post-disaster situation. And in that particular standard, we worked very closely, and we now have a long-standing partnership with the United Nations Disaster Risk Reduction Agency. That's the UN agency in Geneva responsible for resilience across the world. Through a lot of discussions, we've convinced many of our UN partners to think about cities and not just think about national governments in the UN system and member states, to really think about bringing their agendas down to the municipal level. So in this case, WCCD is now a core partner with MCR in that task of making cities resilient 2030, which is a global agenda, and there's now thousands of cities joining this. So every city that's now certified under ISO 37123 automatically becomes a member of the MCR 2030 at the highest level. So we would welcome Brant's entry into this second standard MCR and into the MCR 2030 agenda membership worldwide. So all in all, there's 252 KPIs across these 19 themes. All of the themes cut across ISO 37120 and the other two standards. And the last thing I was going to mention about this series is that we're now, and I have mentioned it one-on-one with a few of you, but we are very happy to announce that the WCCD is now leading the development of this new ISO standard, ISO 37125. In this series, it's on environmental, social, and governance, ESG. These are indicators for municipalities that will help to position cities for more environmentally sustainable, socially inclusive progress while demonstrating their commitment to sound governance. As governments at all levels increasingly commit to more robust ESG frameworks, they're strengthening their position within the ESG ecosystem for the issuance of green bonds, social bonds, sustainable bonds, and to attract investment to support their capital budgets. This standard has proceeded now through the global ISO balloting process. There's 70 countries that vote on the standard each vote, so there's 3 votes. I'm really happy to tell you the last vote happened last month. And for my first time in 12 years history at ISO, it was a unanimous yes. So we got the vote approved. The draft international standard is now in the final editorial stage in Geneva, and it'll be published within the coming weeks. So I'm very happy to tell you that it's through, and if you're interested, we can also discuss that again and how it might support the capital budget plan and investments in the County of Brant. And we would more than welcome you. We're starting to invite cities to become an early adopter of that, and they're titled World Premier Cities, and there's probably 15 to 20 across the globe that will be part of this effort. So County of Brant is, with your stellar success for 5 years, you're more than welcome to join us and to consider that. I'm happy to have a chat offline on that. And then the last thing I was just going to mention before I turn it over to Justine for some of the data points that really are quite stellar as well, the individual data points. I wanted to mention that cities are really stepping up to put this data to work. And I just wanted to share with you these 6 patterns that we've seen across the world and how municipalities are actually using this data. The first one is around economic development to attract investment. So we built an investment attraction tool to support cities in in building that profile on why move to the County of Brant. I'm not sure you have much trouble with that already, though, because you have one of the fastest growing municipalities. We just looked at the stats this morning. I think it was 3.1%, which is unbelievable growth. So congratulations on that. You may not need an investment attraction tool because you're already there. But anyway, we have helped cities around the world with economic development to use the data for ECDEV, for infrastructure development, to help to build the data-driven asks to senior levels of government, provincial and federal in our case. And then also cities are looking at it to localize some of these global agendas like the Sustainable Development Goals of the UN and the Sendai framework, as I mentioned, on resilience. They use it for internal benchmarking, of course, to be able to track 5 years of data. 6 years of data is really quite incredible. You'll see that in a moment. And they also use it to map indicators, this data, to their strategic planning goals. So I would like to now introduce my colleague for the last few minutes just to join me in celebrating the achievement of the County of Brant certification by showcasing a few data points where the County of Brant truly excels.
Thank you, Patricia, and good morning, Mayor Bailey, councillors and all. I'm Justine Hamilton-Arvise, the Director of City Certification at the WCCD, and it's a pleasure to be with you here today to celebrate Brant's 5th year of WCCD ISO 37120 certification, a really outstanding achievement. As Patricia mentioned, today we'll delve into some key data points that really underscore the county's progress towards its strategic objectives and leadership on a Canadian and global stage. Patricia may have beat me to the punch with this one, but as a starting point, Brant has experienced really remarkable population growth. In 2022, the annual population growth rate in Brant was 3.1%, which is almost double Canada's average of 1.8. This surge has led to a significant increase in population density, of course, especially notable since 2018. Even with a rapidly growing population, Brant maintains its commitment to environmental preservation. Nearly a quarter of the land area is designated as naturally protected, surpassing many major Canadian cities. This aligns with the county's strategic priority of sustainable growth. You also boast really exceptional air quality with low levels of fine particulate matter, a key indicator of respiratory and cardiovascular health. Residents enjoy clean air, contributing to their overall well-being and showing leadership in Canada and globally. When we switch from looking at environmental health to looking at economic health, we see a remarkable recovery from the pandemic, with unemployment rates in the Brantford CMA approaching pre-pandemic levels and continuing to decline. This trend underscores the county's resilience and economic strength. Residents also excel in education, with a higher number of higher education degrees per capita, positioning Brant as a real leader in Canada and on the global stage. Brant is also a national leader when we look at affordable housing, with 85% of residents living in homes that meet the Canadian affordability criteria, setting a standard for Ontario and beyond. We also observe impressive progress in energy efficiency, with decreasing levels of public building energy consumption annually. This progress aligns with the county's goals of reliable infrastructure, as public buildings are the largest energy consumers in a municipality's portfolio. You can also see Brant's value compared to others in Canada, and it's particularly low. Similarly, efforts in water conservation are evident in the low per capita water consumption, reflecting responsible stewardship of resources. In terms of safety, we also observe a steady decrease in crimes against property normalized by population, indicating a safer community for all residents each year and comparable to Canada and the globe. Finally, the vibrant cultural scene of Brant, as reflected in the annual number of cultural events, showcases not only the high quality of life enjoyed by Brant's residents, but also the resilience and vitality of city services post-COVID. So it's been a real pleasure to highlight just a handful of Brant's exceptional data points today, representing just a small fraction of the over 90 KPIs that you reported. As we transition to the ceremonial part of our presentation, I'll hand it back to Dr. Maharney. Thank you.
Thank you very much, Justine, and thank you all for your attention to those great data points. We just now want to turn to the last moment, which is our certification ceremony. So it's my pleasure to award the County of Brant with WCCD's ISO 37120 Platinum certification for the reporting year 2023. Congratulations to the dedicated team again at Brant and the tremendous partnership of our close colleagues Adam Crozier, Delia Rush, and Haley Gilmore as our newest partner, all under the exemplary leadership of your CAO, Allison Newton. The County of Brant has showcased a commitment to a data-driven future for its citizens and innovative leadership in local governance. So on behalf of the WCCD, I'd like to congratulate you all and the County of Brant for your commitment to standardized and comparable city data. Mayor Bailey, this standardized data will help to increase the quality of life for all citizens while driving evidence-based decision-making and data-driven solutions. The County of Brant stands out globally as a leader in working to create a sustainable, resilient, smart, inclusive, and prosperous future for all the residents of this great county. So congratulations once again to you all, and I wish you all a very good morning. Thank you. Nice to see you.
It's nice to see you. Thank you for this. I'm very proud to be the mayor of the County of Brant. It's a good news story, but I bring that same pride for my entire council. We are a very diverse council, and we cover many things very well. And the reason that I think, won again, and I'm very proud of that, by the way. They're hung right outside the council chamber door there. Next to the Gallagher room, and we're very proud of the fact that we've done this. But I think it's because we have an amazing staff under Allison Newton, her department when she was headed the department, and all the gathering. And I think staff works better and more clearly when supported by their council, and when we provide a place for them to work without pressures on their own time. And they have enough time to complete things like this, and they do get obviously stellar results. So on behalf of the entire council of the county, I thank you, and to staff, I thank you so much for all you do. You make us look very good, and we appreciate it. So thank you.
Thank you for that presentation. Does committee have any questions about the presentation? Okay, seeing none, can I get what do we want to do with that? Move to receive, Councillor Coleman? Thank you for that. Seconder, Councillor Kyle. Any other questions? All in favor? Opposed? That is carried. Thank you very much. Okay, so moving on, we've got the Brant Community Healthcare System, Emergency Department Ambulance Offload. We've got a delegation coming up. Peter Quinlan, Bonnie Cam, Brian Brennan, and Dr. Samaya Ahmed. If everybody would like to come up, or just, I'm not sure who's all coming up. But again, if you'd like to introduce yourselves, and as was done earlier, you can exceed your 10 minutes if need be.
Thank you very much for receiving us as a delegation. We at BCHS very much appreciate the support of council, and we desperately need community support. And by acting as you do in providing support to us, you are leading the community by example, and we very much appreciate that. Now, it's my very great pleasure to be able to introduce to you our new CEO. Bonnie Cam comes to us from Grand River Hospital in Kitchener, and on behalf of the board, we are very happy to have been able to hire her as our CEO. She's been with us since March 25th and has hit the ground running. So, Bonnie Cam.
Thank you, Peter, and good morning, Mayor Bailey and councillors. As mentioned, my name is Bonnie Cam, and I have spent the majority of my healthcare experience in leadership in a variety of different hospitals, most recently at Grand River Hospital as their Chief Operating Officer and their second in charge, but prior to that have been across the healthcare system in Ontario at William Ulster Health System, which is Brampton, Etobicoke, and Peel hospitals, along with University Health Network, Toronto General, Toronto Western, and Princess Margaret. So this is week 4 for me, and I am very happy to be here and be a part of BCHS. I'm spending my time meeting with our team, our physicians, community leaders, and as well as our partners across the system, including, of course, our county mayor. I'll have the opportunity to meet with, as well as city mayor and councillors, and of course, Ministry of Health and Ontario Health, who will be key partners for us moving forward. I'm starting to learn a little more about the current state of healthcare in the county. And I do look forward to continuing that journey in partnership with all of you. And I do want to thank the county for their ongoing collaboration as we work through some of the challenges, not just this county is facing, but the broader healthcare system. I will now take the opportunity to turn it over to Brian Brennan, who is our interim director of emergency services, along with the clinical director of our maternal child program, as well as our perioperative services, and to Dr. Samaya Ahmed, who is an emergency physician in our eMERGE, along with being the chief and medical director of emergency medicine. Thank you.
Good morning, and thank you very much. As Bonnie has said, my name is Dr. Samaya Ahmed, and I am an ER physician and also the Chief and Medical Director. Thank you, Mayor Bailey and councillors, for having us here this morning and giving us this opportunity to share with you a little bit about our emergency department within our health system. Before I start, I just wanted to take a moment and share a personal anecdote to sort of set the tone for the conversation. So many of you may not know this, but I actually graduated from medical school back in 2007 from McMaster. And the very first medical elective that I did was actually here in the community in the county of Brant. I came to do Rural Medicine Week, and I spent the week with Henry Vlar working in his practice in Ayr, and I had the opportunity to see the community. I went off, finished medical school, did my residency, but it shifted my whole direction of my career. I'd come in thinking I was going to become an OBGYN, and instead I became a rural family medicine physician who then turned into an emergency medicine physician, and here I am before you today. So clearly there's a calling here in this community, and there was some drive to come back and serve this community. So I may not have my address here, but clearly this is a community that means a lot to me. So with that, I have to just figure out how to, there we go, move the slides forward. So today's agenda, as you've seen in the slides that were shared, is we just want to take a moment to talk about our current performance at our healthcare system, talk about the system pressures that are relevant to our area and beyond, talk about our commitment to improvement, and really discuss the local future healthcare system. So our current performance today, we are one of 75 hospitals that participates in the ministry's Pay for Performance program, which is really there to support improved quality and patient experience. There are 71 hospitals that are currently providing data, and so we're one of those 75 hospitals. The 3 most important metrics that we've highlighted for you in this conversation are ambulance offload, which is the reason for our presentation today, our physician initial assessment time, which is, at what point does a patient see a physician, physician assistant, or a nurse practitioner in our organization, and the time that it takes for a patient, once they've been admitted to our hospital, to arrive in a bed that would be accurately labeled as an inpatient bed. We've shared with you our year data in the presentation, but I just wanted to take a moment to talk about how our current performance is fortunately trending in the right direction. So while under ambulance offload, it's 187 minutes when you look over the year, our current performance for the month of March has dropped to 148 minutes. And those 40 minutes were through partnership and struggle to get there. So this is something I wanted to highlight for you. As well, our physician initial assessment time, while year over year it's at 7.1 hours, our performance in March is also at 5.8 hours. And so that's a change of almost 1.5 hours. So again, we're heading in the right direction. And it's through this commitment and this drive to provide the best possible care. As you can see, our performance has obviously been a bit of a struggle for us, and it's really just a symptom of the pressures that we're feeling in our healthcare system, locally, across Ontario, and Canada. These pressures are not unique to us, but we have our unique local demographics that can make those more challenging. So over the last 3 to 4 years, really in the post-COVID era, the system that was already sort of being pushed to its limits before has been pushed in a very significant way. And while pre-COVID, we may have been, caring for approximately 250 to 270 patients in our hospital, every day between all of the different patients that are admitted in the hospital, we're up to 350 patients. That's an increase of approximately 70 more patients per day. As you can imagine, that means that the patients that are coming to our hospital are sicker, and they need that kind of care. They need to be admitted to the hospital to receive the care to improve and hopefully be discharged back into the community. So as our patients become more complex and more sick, there's more of a demand for the bed spaces that are within our emergency department. So this slide is really just an opportunity to share with you about how, while within our emergency department, we actually have 25 bedded spaces. We obviously practice in different ways, and patients may be seen in other spaces. Over the last number of years, we've added to that bedded capacity utilizing hallway medicine, which isn't necessarily the ideal, but it's how we've had to try to adapt to the pressures of our system. And without the support of the county, that wouldn't have been possible. Through dollars that we've had through the county, we've been able to add to those hallway beds while we work towards the future of our healthcare system. So I wanted to take just a moment and really talk about, what does this mean for our community? Why is this important, and why do we need to just spend a moment talking about what our shared responsibility is? So obviously, when there are high times for the ambulance to be offloaded to our hospital, which means that the paramedic crews that bring a patient to the hospital are able to transfer that care over to the nursing staff in our hospital. When those times are increased, this places a pressure everywhere at the hospital and for the emergency services of our community. And it can at times contribute to an environment of something that we call Code Zero at our organization and locally here. And that means that there aren't ambulances available and ready to respond to community calls. This is obviously something that is significant and relevant, and it's really can have an impact on patient safety and can place our community at risk. Our shared goal in partnership with the Ministry of Health, Ontario Health, and our Brantford Medical Services is to both find short and long-term solutions to solve this problem and to eliminate the environment of Code Zero. Our goal is not to just reduce it, but it's to eliminate it. And we're working together to accomplish that goal at this time. So as we just heard, and congratulations on your recognition, this is one of the fastest growing regions in Canada. And as that population increases, there is an increased demand on the health services. In our community, our hospital is aging, our infrastructure is not necessarily meeting the demands of our community. Alongside that, the infrastructure in our community, things like access to long-term care beds, things like access to subsidized retirement homes, are not meeting the needs of this growing and aging population. As well, as a population grows, obviously there's going to be a subsequent increase in patient acuity, and while that's occurring across the province, we tend to see higher levels of this acuity in our local community. So I'm just going to briefly, the reason for this picture is really just to emphasize to everyone that our acuity here is increasing in the most sick of patients, and it is tending, and those are the patients that tend to A, arrive by ambulance, or B, require a bed in our hospital for them to receive their care. I just wanted to share a unique local environmental demographic point. So we have one of the highest rates of opioid-related hospitalizations in Canada. So this is a unique problem here to our community, and that can drive the acuity and drives the need for us to be able to provide those patients with care in their acute visit, and then think about downstream how to prevent their rehospitalization and how to serve that patient population. Another unique local problem that we have that is significantly different than our partners is that we have an increased emergency department utilization by our unhoused population. There are a multitude of reasons for this, but it is different, as you can see. So Brant County is the first column there on your left, and as you sort of move away, you move to less similar communities, but similarly sized hospitals. So we can see that there's been a significant rise and that it's been steadily rising over the years, and it's different than the other communities. This is just to sort of highlight our new environment in the post-COVID era. There is more understanding and awareness around isolation and infection control practices. And in an older hospital, the old environment was there were multiple rooms that were shared by multiple people. And now in the era of infection, really it's about shifting care to be in more private care spaces. And we have a limit of that, which puts pressure on our system, especially during the winter respiratory season. But over the last couple of years, that winter respiratory season has a new definition and is now extending beyond the winter months. So there's increased pressures from all of these different demands. And then this last slide here about system pressures is really just talking about this concept of there are patients who come to the hospital, we address their acute needs, and once those needs have been met, they now need to transition back to the community, transition back to long-term care, transition back to the community with support from home care, or many different destinations. And in our community at this moment, there aren't always adequate resources available for that to happen in a timely way. And so patients have to wait in the hospital because we wouldn't want to intentionally discharge someone prematurely. And so these put additional pressure. So there are at times patients who are waiting for resources elsewhere who wait in the hospital. And of course, there are those impacts that will then filter down to the emergency department experience that we feel. So in our region, I just wanted to take a moment and talk about ambulance volumes and the pressures that we've seen in our community. So as in acuity and the more complex patients come to hospital, they tend to reach for 911 and support to get to the hospital. So our ambulance volumes have increased 6%, as is noted in these slides. This is an additional 700 or so ambulance arrivals. So as more ambulances arrive, there's more of a pressure for us to find a place to place these patients. What I want to say and just take a moment is, of course, when the most acute person arrives with the most critical situation, there's always the opportunity to find them a bed space. It's always those patients who they need a bed, they're okay, where it leads us into this ambulance offload challenge. And we are working actively to try and address it in the environment of increased pressures from all ends of the healthcare system. I just want to shift to talk about our commitment. What is it that we hope to accomplish? What is it that we want to impart here to the council? Is that we've been engaging in biweekly meetings with Ontario Health, the Ministry of Health, our Brantford EMS partners, and ourselves. We have co-developed a work plan to address these issues and really think about all the different solutions that we can bring short, medium, and long term. As well as an organization, all levels of leadership. This isn't just an emergency department problem, this is a system problem, and our hospital leaders are sharing that pressure and that desire to improve. Some of the short-term wins that I wanted to take a moment and highlight for you. Through financial support from the Brantford EMS, we've had an investment in a backhaul nurse, which is utilizing hallway medicine to support ambulance offload. And through that, we initially had some recruitment challenges. There's, challenges recruiting nurses, but successfully we've been able to recruit, and we're almost at 90% of those shifts being covered. So we've been fortunate to be able to utilize the funds that were available to us. While there was some that had to be returned because we were unable to staff those positions, we have been working very hard to fill those shifts so those staff are available to support our patients. As well, over the last 3 months, we've been trialing an increase of physician assistant hours. So physician assistants work directly with the physicians supporting the care, and ultimately the care is the responsibility of the physician that they work with. And by doing that, we've improved our physician initial assessment times, as I highlighted at the beginning. And once a patient is seen, that patient is then able to be discharged sooner or dispositioned sooner, and then beds become available sooner. So thereby, by improving that initial assessment time, we're also improving ambulance offload times. Everything is interconnected. You can't tease them all out and separate them. It's all about the greater work that we're doing. We've also been trying to improve how our data is collected, how we understand our data, because it is through that we can identify and then generate solutions to actually solve the problem in the long term. Some of our medium and longer term plans that we're working on is educating of our frontline staff about surge plans, developing surge plans that are actually relevant to the current environment and that can be implemented, developing language around code ambulance so that as an organization, the reality of the community is the priority of the hospital, because it is really through that collaboration and that working together that we solve the problem. We can't do this as individuals. We have to do this together. So just take a moment and look to the future. So right now, as you'll know, our hospital is undergoing a major renovation project in our emergency department. The intent and the commitment is to enhance the physical space and improve the care and provide a better way to provide care to our patients in our emergency department. Through this work and through ongoing work of just day to day, we are committed to improving and reducing ambulance offload times. And as I emphasize, reducing the environment of Code Zero. Our partnership is key to the success, and we are going to continue to work with the Ministry, Ontario Health, and Brantford EMS to achieve this goal. As well, we haven't really discussed it, but one of our hospital's commitments through a quality improvement plan, which is an annual plan that we submit to the Ministry of Health, is to reduce the time to the inpatient bed. So while we work as an ED leadership team on addressing the first place that patients come, which is the emergency department, the hospital's priorities are also looking at how we can improve that flow through the hospital and through the rest of the system, because they're all interconnected, as I've highlighted. The renovation project is hopefully teed up to end in early 2027, but every step will make improvements as we get there. And so I just want to conclude by saying, as we all know, an emergency department is a lifeline for the community. A hospital is a lifeline for the community. We serve as a safety net for those who sometimes have limited options and don't know how to access care or don't have care that they can access. Our future success is going to rely on planning for that future, which is going to hopefully be a new hospital redevelopment project that's going to allow us to build and design a future healthcare system that will meet the needs of our community. And we will look to you for that support as a community, because it's only as working together that we'll be able to accomplish that goal. And with that, I'll pause and see if there are any questions and turn it over to you, Speaker.
Okay, thank you very much for that. Committee, that's a lot of information there. Questions? We'll go Mayor Bailey and then Councillor McAlpine.
Through the chair to the presenter, thank you very much for coming today. I think why we wanted to have you here and to ask questions is because there's so much information out there right now that wasn't lining up with what we were hearing. So it's good that you're here. It's good that we can ask you things like, how much is this thing going to cost? Is it finalized? And is it going to be a rigged, a Frankenstein version of the hospital? Are we doing a new build? Where is the new build? Because the figures that we were getting when we were hearing figures coming from Brantford, we could never afford to offer up that kind of money. Our population is growing, but I mean, the province has also taken a lot of things downloaded from us, and we just don't have those kinds of dollars available that we heard. Now, those figures might not be real, and we would like to know that, and we would be very happy to know that, because it's very confusing right now. And when we manage the ambulance service here in the county, so some of us sit on that board, and some of us sit on the health unit. So we're gathering information from every angle all the time, every day, and none of it's fitting together as something we can dig into, and we certainly can't save for, because we don't have that many people to call on to come up with those kinds of figures. So, and that scares us as a county, because we like to pay our bills, we like to do our part, and we just felt very, very sort of at loose ends when we heard the figures. So maybe you can make us feel better. Maybe we're not there with the final figures yet. Maybe we need to talk again and start again. And yeah, that's my concern, is that we felt badly that we weren't in a position to be more excited for you and for the build of the hospital, because we just don't have that kind of money available to us.
Absolutely. So I'm the clinical leader, and
Yeah, no, sorry, I was just gonna, and I'm not sure if you're gonna go there as well. I know we have a presentation coming in next month that's gonna deal with that more. I'm not sure if you want to get into any of that today, or if this is just around the emergency department, but I know that's coming next month for sure.
Thank you, Speaker. Yes, no, the intent is that we will be coming back with a redevelopment discussion. We do have forthcoming meetings with the Ministry of Health and Infrastructure Ontario, which is why we've also pushed that out to ensure that we come with the most recent information. It is a complex issue, redevelopments of hospitals to support communities, so we look forward to that conversation when we come back. Thank you.
So I think we'll hold off on that until that presentation comes. Anything else, Mayor Bailey, on that?
No, I don't think there's anything else, and I do
Okay.
know that you're coming to talk about all of that. If you detect any kind of if you felt that we weren't as excited about the hospital, be it the emergency room or the new build, it's not because we're not excited. We are very excited. We just need to know. We just need to know more.
Yep. No, exactly. Okay. Councilor McAlpine, you were next.
Okay, so thanks very much, and it's great to hear the improvements that you're making. And one of the challenges that's been in the news lately is the challenges with patients, say, coming from nursing homes and places like that, with bed sores and pressure sores. And do we have the proper air beds in place at the hospital to assist these people so that they don't come back, say, to the nursing home with bed sores and issues like that?
I'm going to hand it over to Brian, who can speak to that more clearly.
Actually, it's a great question. So what we've been doing the last number of months is sort of a total bed count and assessing all of the surfaces. We do have a wound care team, and the goals of the wound care team are essentially that to reduce and eliminate all hospital-acquired pressure injuries. So part of that is assessing what we have for tools. We now have it's called the Braden scale. It's an assessment tool that we've trained all the staff to do. But once you assess a patient, if there's a risk of injury, you need to have to attach it to a modality, the right surface, the right assessment, etc. So we're focusing now on that modality, and then making sure that if a patient requires something, we would do an order, and then that piece of equipment would be available. So we're actually working on that right now. Pardon me.
Okay.
Does that make a bit of sense?
No, that makes sense. Now, are you in connection with the nursing homes in the area to say if a patient comes in and they already have an acuity towards that problem, that you're aware of it?
Yeah, so that particular
traffic?
assessment, that the plan is any patient that comes in, there's a full body assessment.
Mhm.
So we would do a head to toe assessment looking for those sort of pressure injuries, and then our goal is to prevent it, but also be aware of it when it shows up.
Okay, good. Appreciate that.
If I may add just a comment to
Absolutely,
that,
yeah.
we also have a nurse practitioner who is a liaison with our long-term care facilities across the entire region. And one of her roles is to serve as that liaison around all of these different patient pressures. And so that's one of her roles, is she goes out and does education, awareness training, and just to be able to bridge those gaps in that communication, so that if there are a trend that we're seeing in the hospital that maybe the nursing home wasn't aware of, she has the opportunity to be proactive and share that information with the nursing homes locally.
Very good. Very good. Councilor Miller.
Thank you, Mr. Chair. I appreciate you guys coming in today. I really do. From our perspective, ambulances cost us about $150 an hour for 2 paramedics and the ambulance itself. And the ambulance department is doing a good job of keeping track of how many hours are spent at the hospital waiting with offloads, and we're over 1,000 hours a month, and it adds up quickly, especially for our budget. So yeah, we're highly motivated to see it fixed. I understand it's a system-wide problem. I understand you're working on it all the time. I just want to ask one little piece of the puzzle there that I'm sure you guys are working on, but and I'm asking because it happened to a family friend of ours last week. It happened to my wife last year. They get these bleeds. It might be a knife wound on a hand or something, and they can't stop the bleeding. And it's on the weekends. You can't. There's nowhere to go. All the health clinics are closed. We don't have an urgent care. Is that something that's come up in your discussions? That's my first question. In other words, is there a place someone can go that doesn't have to be the emergency?
Right. So, I mean, within our healthcare system, the other thing that's under our umbrella is the Willet Urgent Care. It's under our healthcare system umbrella. So the hours of that are what they are at this current moment. We're always looking and thinking ahead to how those hours could be expanded or modified to serve the needs of the community. But one of the other things that we already do and commit to within our emergency department environment is we sort of have what we call the main department, and then we have the area that's identified as see and treat at the moment. And that area is there to serve needs just as that in a more efficient way that sort of bypasses that main department, that main needing a bed access. But in the environment of the last few years, we've obviously been struggling, staffing vacancies, physician vacancies, whatnot. And so those times have taken even longer for patients to be seen for simple things. When we commit to addressing one problem, the bonus is that we tend to address other problems. And so that physician initial assessment time being lower is being driven by more activity and more patients being pushed to our see and treat area of our department. And actually, just to emphasize, it's actually one of the key areas that will be optimized by the ED redevelopment project. So we've sort of been thinking this, and things unfortunately take longer than we want. But yes, that is exactly what we are trying to do, and we're trying to educate patients about what the opportunities are available. But the community has needs. There's a gap in primary care, and there's a lot of recruitment energy that is happening that is in partnership with the hospital. But the future of healthcare is going to be thinking outside the box. It's going to be helping patients understand what the options are that are available to them, and just knowing that we are committed to doing the best we can within the system pressures that we live in.
Okay. I didn't know about that other treatment area that you speak of. I will say in both cases, they did not successfully get treatment at the emergency after waiting. The one fellow waited 10 hours and ended up leaving. So, and I'm not being critical. I understand it's a complicated, hard system you have. I'm just saying, well, and you understand. I don't know why, but all the health clinics have to shut down at 6 o'clock or 5 o'clock on a Saturday or Friday. It's very frustrating when somebody has to go there and they don't want to go there. So, and then the last question I want to ask, Mr. Chair, through you, is it was last year, beginning of last year, 2023. The province said, okay, ambulances, you don't have to go to the emergency room. You can go to alternate destinations. And I thought, great, this is great. Well, we'll take them to clinics. Well, it's not as easy as I first thought, because nobody wants these patients. You know what I mean? There's liability. They don't have the staff enough, things like that. So is there any work going on as far as maybe looking at alternate destinations for our ambulances? So maybe the emergency's super busy. Well, it usually is. And they have somebody, and the paramedics have determined they don't have to go there. They can go to somewhere else. Is there any work at your level looking at that?
I don't necessarily think I'm going to have a perfect answer to that question. I think it is our EMS leadership under Russ have really done a lot of work around not bringing patients that don't need to come to the emergency department. And then a lot of times in our region specifically, our problem isn't necessarily these lower acuity patients, it's the higher acuity patients. And we have certainly begun the conversations, but our system isn't set up. So the ministry made this recommendation around alternate destinations, but there are a lot of implications, and there are unique things that we need to take into consideration. Like part of what the emergency department is, there's a triage system that's established and standard across the country. And so when you start to think about alternate destinations, it opens up an element of risk, which can put patients at risk as well. And so we're thinking about it and we're talking about it, but we're still focusing on addressing the biggest pressure, which is the patients that need to come to the emergency department and are waiting. And so that to us is, those are the highest risk patients, and that's where we're focusing our energy on right now.
Okay. And I understand it's a big problem, and I'm probably just picking at the small things on the side, but anything we can do to improve the wait times, we'd love to see it. So thank you.
Councillor Coleman.
Thank you, Mr. Chair. And this kind of like, I guess the question would be is on alternate sending directions to ambulances to go to other area hospitals. Brant County is a vast area, and we have hospitals to the south, Simcoe, Woodstock to the west, Cambridge to the north, and Hamilton or Hagersville to the south. Do you send ambulances when your emergency department is maybe crowded, overloaded? And I'm going to use this example of myself. Last week, I had to go to Woodstock Hospital and went there easy because there was 27 people ahead of me going into Brantford at 5 in the morning, and it was much simpler to go to Woodstock because I guess there was hardly be anybody, and that's where I went, and I was out in 2 hours. So that's my question: do you divert ambulances, or maybe this question to the paramedics, to other area hospitals?
That's a complex question that seems simple. At the end of the day, the Ambulance Act has an expectation that patients of a certain acuity level have to be brought to the nearest hospital, wherever that hospital is in the geography. And then there are also specific arrangements that are for certain criteria: a heart attack, a stroke. They're to go to the area, to the hospital that has the expertise to provide that care in a timely way. Beyond that, absolutely, there are moments when our system is at capacity and we have to consider things like a diversion. And these things always have to be done in collaboration, because what affects us affects EMS and affects those alternate hospitals. What we don't always take into consideration is if we're diverting a patient to a place that is farther away, seemingly close but farther away, that means our ambulance crew is now out of our region, and another ambulance crew from another region may have to come in to serve our community. And so at the end of the day, the need, the focus, the strategy has to be our crews care for our patients, bring them to their local hospital. We have to build the sustainability in our local hospital to provide that care. And then we have to build the relationships for the patients who need specialized care to get there in a timely way.
Good. Councillor Bell.
Yeah, thank you, Mr. Chair, through you to our delegation. First of all, I want to say thank you. 6 months ago, my brother-in-law fell in the bathroom, went grey. EMS was called, went to the hospital, and was thoroughly diagnosed very quickly in the ED. 5 days later, he had a quadruple heart bypass. And if anybody has a complaint about our healthcare system, I always have that in mind to rebut them. So thank you. What struck me in your presentation, which I really liked, was a statement that says the ED volumes have been stable, which kind of runs against the idea that population is growing and it's just a population thing. But actually that patients are coming and they're sicker and they have more complex health issues. So are you seeing, is this just a symptom of something bigger and you're just on the receiving end of this? Is there a bigger social issue that we need to tackle that in turn will help to ease the burden on the ED?
That is a fantastic question, and I appreciate you sharing your personal story. The reality is it's multifold. There's so many reasons that contribute to this. Absolutely, patients who delayed their care needs during the pandemic, we are seeing some of that complexity come out in acuity today. There are things that are yet unknown to us that are driving this increase in acuity. But then there are issues that, yes, we need to address. We need to continue to work together to improve our primary care access here locally. Because when patients have primary care, the complexity and the acuity tends to improve because they are getting regular check-ins before things get to that stage. We have some unique struggles here around opioids, as I highlighted in the presentation, around mental health and addictions, and those things need community efforts. The acute hospitalization is just a moment in someone's journey, and it's a moment for us to intersect with that patient and help drive their journey in different ways. And so yes, there is work there to be done. I think ED volumes remaining stable is also a variable of patients accessing our urgent care for different needs. So that urgent care at the Willett is absolutely serving a need for us. And so people are self-selecting. We are then getting the patients who are the sickest coming to the right place. And as we get better at this, you would like to see ED volumes not increase when you reflect on the patient demographics. They're still going to go up little by little, year over year, but they should go up relative to the appropriate demographics. I don't even think we know exactly to the detail all of the diversity that is coming and relocating to our area. I'll just say anecdotally, we are seeing increased diversity, increased patients relocating from all areas across the province to this region. And with that comes a very different shift. So they've now lost their primary care that was attached to them back in, whether it was Mississauga, Toronto, Milton, Brampton, wherever it was, and they're now here. And so now it's harder to get to that primary care. And so they tend to have issues that they're like, oh, I'll wait to see the doctor. And then 2 weeks later, it's blood pressure that's quite high, or it's chest pain that started off as just a twinge that's now a heart attack. So there's a lot of reasons for this. I don't think there's any quick fixes. And it's going to take local advocacy, local education, provincial education and changes, and then it's going to take federal influence. Like, healthcare is everyone. And at the heart of it all, for as long as I've been in healthcare, the hospital's been at the center of it all. And now we're starting to talk more about how the community is just as important in the healthcare journey. It isn't just about a hospital anymore.
Thank you. I have a couple more questions for me, Mr. Chair. Absolutely. You mentioned the Willett. The first time I ever stood at that podium was just after it was announced that the Willett was likely to close. And I was lobbying for a new healthcare centre, which we now have, thank goodness. But we have a double benefit. We still have the Willett, and we have a healthcare centre. Do you have plans for expanding the capabilities of the Willett? I noticed that you talked about having a lack of places to put people once you finished with them, if you like, at their hospital. It struck me that Willett would be an obvious place to try and expand under a much lesser cost per bed than it would be to build a new hospital.
Those are exactly the conversations that we're having, but they're at the conversation levels. As we've identified what our pressure points are, we are starting to think about, okay, what's our 5-year plan? How can we use a resource that we have right now in a more effective way? So that is absolutely the conversation that we are having at this moment.
Okay, final question for me. There's a graph here which shows increased ED utilization, and there are 6 hospitals or 6 hospital systems, sorry, 7. There's one of them going in the opposite direction to you, only one, and that's Guelph. What are they doing that we could learn from to improve our performance?
To be honest, I have not looked deeply enough in the data to know what it is that Guelph is doing, but I'm going to make an educated guess that it's going to have been a collaborative effort, because I think it's not just about a hospital or just the community. It's about what are we doing together to reduce those burdens. But that's not a unique problem in our region. It's just the volume of it maybe is a bit higher than others, but it is a federal problem, it is a provincial problem, and it is also a municipal problem. So that is part of our goal, is to start to see what other areas are doing, and we've already engaged in that conversation with our city partners about how can we help support our unhoused populations more effectively. There may not be immediate solutions around affordable housing and whatnot, but what is it that we can do to help them navigate the system better? Because sometimes it's the navigation of the system that keeps people in their precarious living situations.
Thank you. Much appreciate your answers.
Any other questions from committee? Okay, if committee would indulge, I've just got a couple quick questions myself. And I want to say absolutely thank you very much for this information. I think we all understand what a battle you folks are facing, and we appreciate you doing it on a daily basis. for our community. On page, I guess, when you speak of the impacts on our community, you've got Brant County Health Services working in partnership with the Ministry of Health, Ontario Health, Brantford Brant Emergency Medical Services, EMS, to find both the short and long-term sustainable solutions. As Mayor said, a few of us are on the paramedic services. I'm one of those, so I know how hard Russ and his team works. I'm going to ask this very bluntly. Do you, because you speak of the Ministry of Health and Ontario Health, do you feel they are pulling their own share to help out this problem? If you don't want to answer that, I appreciate it, but it just seems that, we hear about a lot of roadblocks, and I know it's not you guys putting up the roadblocks. I know it's not EMS putting up the roadblocks. I'm just trying to understand, are they at the table like everybody else is?
The reality is, in a healthcare system like ours, that is as intricate as it is and has as many layers in it that are involved in funding all the different pieces of it, everyone has a different responsibility at the table. The fact that the Ministry of Health and Ontario Health are at our table just gives us a lift, in the sense of, we now have heightened awareness on the problem. We now have the ability to engage the people at the frontline level to understand that they're not the problem. We now have the attention of those higher than us, helping us to solve the problem. They have access to people's ears that we don't always necessarily have access to directly here. And, sometimes we don't always want attention for the wrong reasons, but sometimes that attention serves to drive change. And so in this case, the attention has come at a time when we were already committed to change, but now we've got resources available to us through accessing different ideas that are happening at other organizations in a more efficient way. Sometimes it's hard to connect with all the different regions. Like, there's, as I said, just 75 that are participating in this Pay for Performance project. To try and find out what everyone is doing would be challenging. But Ontario Health and the Ministry of Health obviously have that information readily available to them. They know who the right people are to talk to. So they are helping us, and that is the most important element of it, and that's the part I'm most comfortable answering for you.
Okay, I appreciate that answer. And one final one I have here, and again, I don't mean this in a negative way, but it's our shared goal to eliminate the environment of code zero caused by ambulance offload delays at BGH. Again, I appreciate that statement. I think that's what we all want, but let's be honest here. Do we really feel that's attainable?
The reality is, it is attainable. If we don't have a goal that's aspirational, we aren't going to work 100%. Towards addressing the problem. How we're addressing it locally is to try and stay one ahead. So even if the goal, the driver for increased surge, or trying to divert resources within the hospital is, there's only one ambulance available out there, let's try and mitigate that problem. Absolutely, there is an opportunity for this. The key in this statement here is we are trying to reduce the ambulance offload delays that are being driven by system blocks. So we're trying to remove the system blocks. If there are 10 ambulances calls out in the community, and 11th one comes and everyone's out, that's a precarious situation. That's a reflection of our community, and that may drive us to increase the resources that are available for that call volume that exists out there. But we need to have an aspirational goal like this, because we need to drive it. We know that our performance leaves room for improvement, and I believe, personally for me, is you have an aspirational goal, and then you got to break it down into the smart pieces, which is what we're doing. Most importantly, what we're doing is we've broken it down into the smart pieces. The goal that we're actually being asked to is how many, having ambulance offload be less than 30 minutes. That's sort of the metric that's across the province. So that's the goal. When we're starting at 180 minutes, we have room, and this goal will help us to start breaking it down into smaller chunks so we can get there. We'll get much closer to there than we are today by this collaborative effort.
I like to hear that, and I appreciate that answer. And again, thank you for what you do. Committee, how would you like to go forward with this? Thank you, Councillor Coleman, Councillor Bell. All those in favor? Thank you, that's carried.
Thank you very much for your time.
Thank you. Very good. Okay, so we're gonna move on now to, section 5, adoption of the previous minutes. Can I get a mover, please? Counselor Howes, Counselor Oakley. Any questions? All those in favor? Opposed? That is carried. Any business arising from those minutes? Seeing none, we will move on to consent items. Consent items be approved. We got a couple here. RPT-0248-24, appointment of an engineer for the Simmons Hopkins Municipal Drain. Can I get a mover to get it on the table? Councilor McAlpine, seconder. Councilor Kyle. Questions on that one? Councilor Chambers.
Through you perhaps to General Manager Walton, not specifically to this, but there are aspects of this that may help to answer the question. When a property owner petitions for maintenance, and emergency maintenance, for example, if a tile blows out or the drain's plugged or whatever, and we go through a process where we have to determine that perhaps the drain needs to be redone or re-engineered or whatever, how does that play with the emergency that is there? The guy wants the drain cleaned, and we're saying that we have to go through an engineering, and it takes and takes and takes. For example, the Harley drain or the Bennett drain. I mean, how does that reconcile with getting the drain fixed for the property owner that is experiencing the emergency?
Through the chair to Council Chambers. So, under the Drainage Act, the municipality is responsible to keep drains in repair. It's a pretty broad statement, and it doesn't tell you how to do that. So, you use the example of the Bennett drain. There have been a number of repairs done over a period of years on that drain. It's a drain that's parts of it are like 80 years old, and some of it's from the 60s and the like. So there have been repairs done on the drain. You'll recall recently we appointed an engineer on the Mount Pleasant drain. And the Mount Pleasant drain, that came to us because our drainage superintendent is working on some improvements that, as maintenance, it came to our information that the owners don't like what's happening to do that. We found out that there's way more work that really needs to be done, so we appointed an engineer. We're going to do we're working on doing a bit of sort of emergency clean on that to keep the status quo going as we have to till we get an engineer's report on. So we do that all the time. So, there's a tile blowout. You fix the tile blowout as best you can. You realize it's undersized. You bring the either a Section 78 or a Section 4 request to council. So, yes. Are they all as successful as we'd like them to be, those repairs? Not always. Seldomly are they adequate to last for a long period of time. We do the best we can to not have holes in the field.
Councilor Chambers, okay. Any other questions on that report? Seeing none, all in favor? Opposed? That is carried. RPT-0261-24, cemetery maintenance and internment services. Can I get a mover, please? Councilor Kyle, Councilor Bell. Questions on that report? Okay, seeing none, I do have one question. With the bids that came in, I understand that price is definitely one of the objectives here, but this scares me. It's like almost $350,000 cheaper than the other. Are we definitely apples to apples with these quotes? Because something, if it is, that's great, but it just tells me that the others are overcharging. And have these folks done work for us before? Not sure who can.
Through the chairs. Through the chairs.
No.
Through the chairs. So
We just got to get you another mic here, Phil.
Through the chair, that's a very good question. So it's actually the contractor that we're working with now, and we've been working with over the last 3 years, and very satisfied with their service. The increase that they're asking for is, what we would have anticipated. So the bids are far apart, but we have no concerns with the award.
That works for me. Thank you. No other questions on that report? All in favor? Opposed? That is carried. RPT 0264 24 2024 tax rates. Can I get a mover to get it on the floor? Mayor Bailey, second. Councillor Oakley. Questions on that report? Councillor Oakley.
Through the chair to staff, I believe when we passed the budget, we did also ask for a report in regards to tax relief. Whereabouts is that report, or when can we expect that report?
Heather?
Through you, Mr. Chair, that report will be coming to the May policy meeting.
Perfect, thank you.
Other questions on that report? Seeing none, all in favor? Opposed? That is carried. RPT 0267 24 Community Improvement Plan application for 48 Main. Can I get a mover? Councillor Kyle, seconder. Councillor Howes. Questions on that one? Seeing none, all in favor? Opposed? That is carried. RPT 0228 24 awards of OPS Cornell Culvert Rehabilitation. Can I get a mover, please? Councillor Miller, second. Councillor Oakley. Questions? Seeing none, all in favor? Opposed? That is carried. RPT 0215 24 Birch Road Resurfacing Award. Can I get a mover? Councillor Coleman, second. Councillor Garneau. Questions on that report? Councillor Bell.
Yeah, thank you, Mr. Chair. Through you to staff. Tender amount is 1.09 million. The budget remaining is 2.075. Where is that remaining budget going?
Mr. Walton.
Through the chair to Councillor Bell. So there are other costs on a project like this, like our time to oversee it and any geotechnical work and the like. So it's the tender amount isn't the entire project, but there is additional money here. We occasionally save money on projects, and be thankful. We'll use it elsewhere very, very diligently.
I'm all for a good news story, Rob.
Yeah.
Oh, good. Any other questions? All in favor? Opposed? That is carried. Moving on to 717, RPT 0222 24 pavement markings, longitude lines award. Can I get a mover? Councillor Bell, Councillor Coleman. Questions on that report? Okay, seeing none, hopefully 8th concession between Bishopsgate and Harley Road can be done with this if it's approved. All in favor? Opposed? That is carried. 718 RPT 0287 24 Paris and Burford Skate Park Design Build Tender Award. Can I get a mover? Councillor Bell, Mayor Bailey. Questions? Councillor Miller and then Councillor Bell.
Just a comment, just a shout out. I think this Burford Skate Park, I think we all know that it's been in the works for a long time. You can see it has deep community support from the fundraising they've done. So congratulations to the Optimists, and particularly Heather Kern, for pushing it. I think your Councillor Chambers is a member of the Optimists. So they've done very well. And I'm grateful to staff, especially Kathy and Stacy, for working with them. So I think it's going to be a very nice complement to the other services that are offered there at the Burford Arena area. So very happy to see it.
Councillor Bell.
Yeah, again, my thanks to staff for getting this moved, and particularly the Burford Optimist Club for raising such a large amount of money. I have one excited grandson who lives in Burford. He keeps pestering me, show me the drawing, show me the drawing. So I send him the drawings, and he's excited about that. My question is, there are 2 phases to the Burford Skate Park. Does this contract cover both phases, and are there any additional phases to come?
Who can answer that? Phil?
Through the chair, so from what I understand, we've got a concept plan that will now produce through a design build process to finalize what you see on the concept. So but I'm not aware of this second phase. Unfortunately, Kathy couldn't be here today, so I may have to get some more information for you.
Yeah, thanks, Phil. The package of information you showed us does have a final concept, and it does talk about a phase 2. So if you could clarify that for me, I would appreciate it. Thank you.
Okay. Councillor Chambers.
Just a comment, Mr. Chairman, and that's with regard to the contribution that the Optimist Club makes to this project through fundraising. And it's always not easy to fundraise in small communities, but the Burford Optimist Club is well served in that area. And to that end, don't forget that the Optimist Cookout is coming up quite soon. And if you'd like a ticket, it's $40. And please support the Optimists who support the community by doing things like providing money for skate parks.
Good segue. Any other questions on that? So just one question I have, and it's regarding down at Silaps. I've had people ask me, and I just want confirmation. With the addition to the Silaps skate park, that means that that ball diamond will be gone.
Through the chair, that's correct.
Okay, and do we have any such idea, as it says in the report, in the next few years, an additional ball diamond? Do we have any more information on that?
Through the chair, we're working through the parks plan right now, so it's under consideration. Yeah.
Okay, thank you, because I know it's well used, so I appreciate that. Okay, no further questions on that. All in favor of that report? Opposed? That is carried. 719 RPT-0289-24 Community Improvement Plan for 11 Grand River Street North. Can I get a mover? Councillor Howes. Seconder, Councillor Coleman. Questions? Seeing none. All in favor? Opposed? That is carried. Couple more here. 7110 RPT-0290-24 Community Improvement Plan for 56 Grand River Street North. Mover, Councillor Howes, Councillor Oakley. Questions? Seeing none. All in favor? Opposed? Carried. RPT-0170-24 Consultant Award for the North Paris Fire Station Detailed Plan. Can I get a mover? Councillor Coleman, Councillor Kyle, questions? No questions? We're not going to make the chief wait any longer, I guess. All in favor? Opposed? That is carried, unanimous. Okay, consent items to be received. There's 3 of them. Does anybody want any of them pulled? Councillor Bell?
7.2.3, please, Mr. Chair.
Councillor Miller? Okay, so we're going to go 7.2.1 and 7.2.2. Can I get a mover? Mayor Bailey, Councillor Oakley, questions on those 2? All in favor? Opposed? Carried. Councillor Bell to 723.
Yeah, thank you, Mr. Chair. Through you to Andrea. I think I mentioned before that one of my constituents believes that we're going to run out of water in 7 years' time. I think the mayor knows which one that is. Your report is reassuring that we're not going to run out of water. My question is, how do you measure that we're not going to run out of water? It says we're not going to, and I'll believe you, but I would like to go one step further and tell me, how do we actually assess that we're not going to run out of water?
There we go. Through you, Chair, to Councillor Bell. So we have a number of approvals for all of our municipal drinking water systems. This specific report speaks to our requirements with our permit to take water. So the permit to take water approvals speak to the volume of water that are coming out of our aquifer and also monitoring the quality. So the difference between this report in particular and the report that I came to you with about a month ago is that the report from a month ago is speaking to water going into the system And this is coming out of our resource. So through our annual monitoring of our quality, we monitor the flows. We have a number of due diligence environmental wells throughout our system. So we see the effects of our water taking on the actual aquifer. And then we have a third-party consultant that will speak to our recharge of the aquifer. And I can assure you that there are no issues currently with the volume of water coming out of any of our drinking water systems.
So if I may just simply put, all the little wells that we have around the place that are not actually producing but are just monitoring, you can actually determine the water level in those wells so that we can see that it's consistently where we want it to be. Is that simply put?
Through you, Chair, yes. The aquifer monitoring reports will also tell you through those blue casings, those monitoring wells, how quickly the resource recharges. So you do see effects on the water resource while our pumps are pumping, and then it also speaks to how quickly the aquifer recharges, which is reassuring on the volume of water.
Thank you.
Thank you, Mr. Chair. Through to Andrea. Andrea, in your reports, you state that for Mount Pleasant drinking water system and the Bethel wells, you're recommending a salt management program through the roads department and the risk management official. You're recommending that. Will we see a report on this, or do you need a motion from us to make that happen? What's the plan there?
Through you, Chair. The plan here is to work through our policy team who's managing the risk management official contract and start to develop a program for the County of Brant to mitigate the risk of salt. So there's a number of different things. We'll focus in on the problem areas, which primarily are Bethel right now and Mount Pleasant. Those are the priority areas. We'll develop a larger program, salt management program for the County of Brant. Roads does have a big participation in that because of their salt application. So we have the ability to lead by example here in the county with our own operational department, and then the risk management official will reach out to property owners and extend that same type of program to site-specific operations.
Okay, so sorry. Just to be clear, you're recommending it, but it sounds like it's going ahead. Is what I'm hearing you say.
I understand, through you, Chair. I understand that we have the ability and the requirement to do this through the source protection policies. There will be an annual source protection policy update, I believe, coming to ANO next month. Through the policy team, and within those policies we have the ability to do that. So I don't believe that we need additional approval from this committee here.
That's what I was asking. Okay, thank you.
Okay, no other questions on those ones. So as far as 7.2.3, all in favor? Opposed? That is carried. Okay, moving on to staff reports. RP 8.1, RPT-0253-24, Children's Services Funding Agreement. Can I get a mover? Councilor McAlpine, Councilor Kyle, questions? Seeing none, all in favor? Opposed? That is carried. 8.2, RPT-0254-24, 2023 Ontario Plus 55 Games Final Report. Can I get a mover? Mayor Bailey, Councilor Bell, questions? Seeing none, all in favor? Opposed? That is carried. 8.3, RPT-0260-24, naming of South Picnic Pavilion in Lions Park. Can I get a mover? Councilor Howes, Councilor Chambers, questions? Councilor Howes, then Councilor Coleman.
Thank you, Mr. Chair. I'm very much in support of the idea of this pavilion in Lions Park being named after Darren Ayres. That's appropriate. I wanted to take this opportunity to ask staff to remind me or clarify to me what is the process when it comes to determining naming of parks or assets within parks or memorial benches. Even streets in the town. This is a subject that comes up to me from residents in the community often, where they're recommending that a family name be used, and it's someone with a history in the community or whatever. I'm just wondering what's the best way to channel those conversations. I think it kind of relates to this a little bit.
Okay. Stephanie, I see you came online. Are you going to tackle that one? Oh, we can't hear you. Oh,
Hello?
there we go.
Okay. I can answer some of that. So in terms of memorial bench tree naming, we do have a separate program for that. That is all through our cemeteries area. So in terms of that, that's how that is dealt with. As for naming of parks or recreation assets, we do have a policy for that. And it outlines the naming of new assets as they become onboarded, renaming of any currently existing assets as well, and the protocol required for that, the criteria of any name submissions. But names can be submitted at any time, and then we go through a public engagement piece for that. When we are doing new asset onboarding, we will do a public engagement piece to request names for those, and we are looking at going for a larger naming for some that we are doing in the future, because we have a large number of parks in Paris that are continuously onboarding in the next few years. But as for this one, it was a name submission that was recommended, so we are just asking that it goes forward for public engagement and comment on that name at this time.
Councillor House?
Great, thank you for that information. And would it be accurate to say that the people seeking more information on everything you just described could find that on the county website?
Yes, they can.
Thank you.
Okay. Councillor Coleman?
Thank you, Mr. Chair, and I'm fully supportive of this pavilion named after Darren. My question is to staff is, what is happening with something being named after former Mayor Ron Eddy? We asked for that a number of months ago to see if something would be coming forward or whatever, and I've heard nothing. So I just was, when I read this here the other night, that just kicked my brain into gear. So I just would like an answer.
Who can tackle that? Anybody? Allison? Right to the top.
Through you, Mr. Chair. We haven't landed on anything yet, but I will follow up on that and make sure that a report comes back next month.
Okay. Councillor Chambers?
Just to say that I recognize there's a process, and it'll run through the process, and I'm sure at the end of the day, the Paris Pavilion will be the Darren Ayres Pavilion. Darren, you may not know, well, you probably do know Piercy, that he started as a rink rat in Burford Community Center, and he's a perfect example of someone in a system that starts at the bottom and works his way up to being, excuse me, up to being the manager of the Sillaps Arena. But from rink rat to manager of Sillaps, it shows the character and dedication that Darren had, and it's a good choice, and I fully support it.
Thank you for that. Anybody else? Yeah, I guess, and again, I know I shouldn't as chair, but I wholeheartedly support this as well. Well-deserved, and knowing Darren as I do, he's a very, very humble man. I just want to understand, is he aware of this? Because that's, I think, and again, I don't mean this in a bad way at all, but I fully support it, but he might have a problem with this. I don't know.
Through you, Mr. Chair, we have spoken with Darren Ayres' family regarding the naming, and they were fully supportive of this as well.
Fantastic. That's excellent. Okay. So that's another good news story. All in favor? Opposed? That is carried. Look, we're flipping the page. Okay, so 8.4 RPT-0266-24 taxi fare increase request and vehicle for hire bylaw. Can I get a mover? Councillor Bell, seconder. Councillor McAlpine. Questions? Councillor Miller.
just the question is, the request was for a 20 cent a kilometer increase from 330 to 350. That was from, I think, Paris Taxi. And then Grand River Cab had asked for a base rate increase from 6 to 9. That's been taken out. I'm just wondering if maybe Greg can speak to why that is.
Can we just confirm that red light's on? Just confirm the red light's on. It didn't say red. Nope, I don't think it's on. Is it?
Oh, green light.
There we go.
Sorry about
That
that.
red light.
Through the chair, we looked at this as part of the supplementary report. For us, I think we were looking at a balanced compromise for the fare rate, and we thought that the 20 cent increase was fair. We chose that over the other proposal, which was a flat rate of $3. So whether you do a 2-kilometer ride or a 10-kilometer ride, the $3 flat rate would apply. So we thought it was probably more prudent to take the other route with the kilometric rate.
Okay, they may not be happy, I suspect. Is this an annual thing? They can come and ask for an increase, or say they're not happy? Could they come back next month and ask for an increase? How are we handling the request for rate increases?
Through the chair. So yeah, that we do canvass them annually. I think that came up in 2021, and I think there was a desire for us to do that, which is what we've done.
Okay, so just supplement that. Then if they want another increase, we'll see it next year. Then I guess.
Through the chair, correct.
Any other questions on that report? Councillor McAlpine.
This is more of a comment, and I'm not sure if this is the appropriate spot to do it, but it has to do sort of with the changes in the taxi industry to when we took on Brant Rides. And something that's kind of happened in the last, I guess, few months that I've come aware of was that we used to have a subsidized taxi system, okay, for people that were handicapped when they went for a ride. And apparently when we switched over to this, and we're going to have a report coming up in the next couple of months, but maybe the other people on the council aren't aware of this. I had a constituent say that they were having problems with the Brant Taxi, where they were like a couple of hours late picking them up, and then they came half hour early dropping them off. And it had to do with they're 92, hard of hearing, hard of seeing, and in the past there was an extra care taken for the people getting rides. And so the person would say, the past taxi service would come up, knock on the door and say, hey, I'm here to pick you up. And now they just send a text where she doesn't have a cell phone to receive the text. And I understand with other people with handicaps, there's issues with that. And so we've kind of took that extra care of service away with the new providers. And I think that's something that we should be aware of and something that we will probably want to address in the coming months. So in this person's case, this has happened to her twice. And so she's scared to take Brant taxis or Brant rides. And so I just thought I should be aware of that.
So just for clarification, is this through a taxi service or are we talking Brant E-Ride here?
It's Brant E-Ride now, but it used to be provided by Brant Taxi or our Brant Taxi service.
I just wanted to make
So
that
that's why I'm
clarification.
saying it's something that's been taken away, and I don't think as a counselors we were aware that that happened.
Melissa?
Thank you. Through you, Chair, to Councillor McAlpine. So Brant Transit is currently operating as a public transportation program. Staff will be bringing a pretty comprehensive report back about transit as we continue to learn about what the community needs in June. That's scheduled for the Admin and Operations Committee. In that, we will be talking about the need to look at having specialized or paratransit options. We have talked with our partners at the City of Brantford about what shared service could look like for that service, as well as with our current provider about how they could also accommodate. So that information report will be coming forward in June.
Okay, thank you for that. Councillor Miller.
Yeah, no, I know we're not getting a little bit off topic, but I wanted to correct something. Councillor McAlpine said Brant Transit, I think, or Brant Ride you're referring to, and the accessibility fund, it was about 160,000, 180,000, something in that range. It was rolled into this, the monies we used to pay for that. But the point is well taken, though, that the accessibility component maybe has gotten lost in the translation. So maybe we can hear something from the accessibility committee. And I will share, I mean, we do get the monthly reports from staff, and thank you, Melissa, for that. I will say they're not capturing all the complaints. I know a woman who has an appointment, a senior. The appointment's at 11:15. The ride scheduled for 10:45. That ride never shows up. It just never shows up, and that appointment's gone forever. So very frustrating to hear those stories. And like I say, I know they don't get carried through the statistics. So I'll leave it at that. Thank you.
Okay. All right. Oh, do you want to say something? Yeah, Allison.
Thank you. Through you, Mr. Chair. I just want to make a clarification. So we do have accessible vehicles in the fleet for Brant Transit. What it doesn't, and we do allow support personnel to ride for free. Also, if somebody has that, it doesn't provide specialized services. Councillor McAlpine mentions in terms of the drivers helping passengers, and that's primarily because it's a public transit system. It doesn't have that service. So that would be what's lacking. But there are accessible vehicles, just to make that clear. Secondly, I would just suggest if any councillor hears of anything, or if there's any complaints, as you mentioned, if they could be referred to our transportation supervisor so she can follow up and make sure that we're addressing those.
Okay. All right. We're going to circle back to the report here for the taxi fare increase, but that's okay. No further questions on that. All in favor? Opposed? That is carried. 8.5, RPT-0273-24, Municipal Accommodation Study. Can I get a mover? Councillor Oakley, Councillor Kyle. Questions? Councillor Miller?
A quick comment. To me, the most effective sentence in the report is this should be guided by a longer-term goal for permanent accommodation. I couldn't agree more. I think okay, short-term, do we have enough chairs, enough desks, enough tables here, there, wherever? I think that's an easy fix. It's that longer-term goal. Should we be opening up another office here or there? Should we be closing offices? Should we be consolidating? So I think if done right, and like you say, guided by a longer-term goal, we should get a lot of information. So yeah, keep your eye on the long term.
Councillor Oakley.
Through the chair, I would agree with Councillor Miller, and I think as well as part of this, one of the questions that we've had many times in regards to projects like affordable housing is lack of publicly available land, because we have various office buildings that are potentially underutilized. So I think this will be a good opportunity and project to assess that as well.
Any other questions? Seeing none, all in favor? Opposed? That is carried. Okay, on to section 9, committee reports. Brant Heritage Committee, March 7th. Can I get a mover? Councillor Howes, Councillor McAlpine. Questions on that report? Seeing none, all in favor? Opposed? That is carried. 9.2, Cemetery Advisory Committee. Can I get a mover? Councillor Coleman, Councillor Chambers. Questions on that one? Seeing none, all in favor? Opposed? That is carried. 9.3, Sports Hall of Fame Ad Hoc Committee. Can I get a mover? Councillor Kyle. Second, Councillor Mayor Bailey. Questions on that report? Seeing no questions, just one statement I'll have on that, and it's regarding one of the nominees for Paris. Stuff like this, it has absolutely made this family so proud. It's incredible the humbleness of this athlete. I'm talking Richard Ward here. They're just absolutely blown away that the community would do something like this. And then, it reaches a little further. I'm walking through the maple syrup on Saturday morning there, and who do I run into? Steve Fergus is another one that's going in this year, and they're absolutely blown away that the community is doing this for them. So this type of thing is amazing, and all you need to do is go through, whether it's Paris, whether it's St. George, whether it's Mount Pleasant, and see the folks that have been, made note of from our community. We've got some pretty interesting folks here, and this is just great. So, all in favor? Opposed? That's carried. Okay. 9.4, Tourism Advisory Committee. Councillor Oakley. Councillor Kyle. I think Councillor Howes is leaving us. Any questions on that report? All in favor? Opposed? That is carried. Accessibility Advisory Committee. Mover. Councillor Oakley, Mayor Bailey. Questions? Seeing none, all in favor? Opposed? Carried. Brant Connects Committee Report. Can I get a mover? Councillor Miller. Councillor Coleman. Questions? All in favor? Opposed? Carried. Communications, I see none. Other business, nobody said anything. Does anybody have anything for other business? Councillor Chambers.
Actually, Mr. Chairman, it is under the addendum, other business, the Scotland Optimist Park.
Oh, yes, it is.
And I'll speak to that. Some of you have heard this before because I bring it up quite often. For those of you that don't know, Scotland Optimist Park is owned by the Scotland Optimist Club as a result of an agreement many years ago with the former township of Burford, who actually purchased the property and then sold it to the Scotland Optimist Club. And there's an arrangement and a purchase agreement, etc. And part and parcel of that purchase agreement going back in the day was that funds were to be provided for the operation of the park, etc. This has always came to council and committee in the form of a grant request from the Scotland Optimist Club to assist with the operation of the Scotland Optimist Park. And every year I have to explain that it's really not a grant. It is a commitment that was made as a result of a purchase agreement going back 20 and 30 years ago now. So my concern is, and the Scotland Optimist Club concern is, that through the grant process that is going through the Community Foundation, that the powers that be that are determining the grants may not understand that this really isn't a grant. It is a commitment that we are obligated to pay as a result of the purchase agreement going back when. So I don't want the county and the Optimist Club to be embarrassed if the Community Foundation turns down the grant, and then we're into a kind of a situation where we have to do something about that. So just as an awareness for those that don't know and perhaps have forgotten or do know, and I'm being repetitive, the Scotland Optimist grant for the operation of the park is a little bit different than many of the other grants that are being applied for. And that's all I wanted to say.
Mayor Bailey?
The terms of that agreement, is it a forever thing? It is a forever thing?
It was a condition of sale and purchase. So it would be a permanent thing.
To that, Councillor Oakley? Go ahead.
Through the chair. So I believe, and staff can correct me if I'm wrong, but
I believe that falls under one of our ongoing grants, which isn't under the purview of the Brant Community Foundation. We're going to be doing an assessment of our ongoing grants next month after, which I think, from my point of view, is exactly what you're saying is part of how we're framing these ongoing grants is perhaps not appropriate. Because in this case, it's not a grant, it's an ongoing purchase agreement. Perhaps then the conversation needs to be rolled into the parks budget, not as part of our grants process, because it's not a grant, it's a purchase agreement. And I think that's part of the larger conversation we're going to have when we get to those ongoing grants, where a lot of them aren't quote unquote grants, even though they're being treated as such and are being framed as such right now. So that's just my 2 cents.
And just to conclude my comments, and I'm glad to hear that it's not going through the community foundation, and that's the way it should be. And my other lasting concern is that as time goes on, actually, I think 5 of the 7 signatories of the purchase agreement are now not with us anymore, and I'm not going to be here forever. And someone has to remember this, so I don't have to bring it up year by year by year. So somehow that has to be enshrined, that the Scotland Optimus Park is partially funded by dollars from the county, and it's a great deal for the county, that kind of thing. So there is, again, terms in the original purchase agreement that if the Scotland Optimus Club folds, we get the park, but those kind of things need to be remembered. So I don't have to bring it up year after year after year.
So, Councilor Chambers, you weren't part of the purchase sale agreement. You're going to be here forever? It's in there somewhere, isn't it? Yeah.
My name, my signature is on this agreement, so that's how I can remember it.
There you go. Thank you for that. Councilor Kyle, did you have something for other? No? Okay. Nobody else has anything for other business? Okay. Nothing in camera. Next meeting of committee is May the 21st, which would have been my father's birthday. Motion to adjourn. Councilor Oakley, have a great day.